You can also watch the show on our webcast. Check out our YouTube channel. Search Out of Bounds Sports. We're live in the Bank Plus studio. The SEC Insider Hit this morning is brought to you by Mississippi Sports Medicine and Orthopedic Center. Any age, any sport, any injury, they've got you covered at Mississippi Sports Medicine and Orthopedic Center. And so we've been talking about the NFL Draft, which is 8 days away. Thank goodness. We're excited about it. And Tua Tagovailoa will go in the first round. Quarterback at the University of Alabama, had a remarkable career. But it ended in November in Starkville, Mississippi. He suffered a hip injury, had surgery. And, of course, some of you have watched the video of him working out and coming back, and we know that he'll be drafted at some point in the top 5 or 10 on Thursday of next week. And we wanted to bring in hip and knee specialist with Mississippi Sports Medicine and Orthopedic Center, Dr. Jason Kraft, who also worked the NFL Combine a couple of months ago, and we'll talk about that a little bit later in the interview. Jason, good morning. How are you?
I'm good, Bud. Thanks for having me.
Absolutely. Thanks for taking some time with us today. So Tua is one of the biggest names in the draft, and his season was cut short because of a hip injury and surgery. And so if you would, and there's all this discussion around risk reward and so on with Tua, but we have this with players every year, as you know. So walk us through the injury and the surgery and the rehab process, if you would, Dr. Kraft.
Sure. So, I think, most people know that. So he had a dislocation of his hip when he was playing in Starkville this fall. He not only did he dislocate, but the hip is really a ball that's inside a socket, and that's what makes it stable. It makes it have a lot of range of motion. And so when he dislocated, he actually fractured off part of the rim of that socket. So there's a couple of issues there. Number one is that you need to get the hip back in the socket just as quick as you can. The quicker you get it in there, the less chance of the blood supply to the ball part of the hip being damaged. And that's really the biggest long-term or kind of intermediate-term problem with something like this. And by all accounts, the doctors at Mississippi State and Alabama worked together, and they had his hip back in place very, very quickly. And then the issue becomes, how do you keep it from coming out of place again? And so that's when you have to make a plan to get that socket fixed. And he went out to Texas and had probably the preeminent pelvic and fracture surgeon in the country fix it. And by all accounts, everything went great. He had no other damage around his hip, by reports. And so then it just becomes a little bit of a waiting game to make sure that he's not going to damage the blood supply. That's really the only thing that you really don't have any control over. Once you dislocate that hip, that's just a risk factor. And to my knowledge, he's had absolutely no problems with that. You see the videos of him working out. If he was going to have issues with that, they likely would have already developed or been present on MRIs, and certainly haven't seen those reports. And that's why he stayed at the top of many draft boards. And so from a rehab standpoint, it's really just a matter of letting the fracture heal. And that's what he's done, initially when he was on crutches. That process actually goes pretty quick. It's quicker than like an ACL injury or something like that. So once that heals, then it's a matter of regaining range of motion and strength. And then, for him, all the mobility that he needs to play quarterback in the NFL. And by all accounts, he's done, and watching the videos, he's done really great with that. So from a hip standpoint, I really don't think that's going to be an issue with him moving forward in the NFL.
Dr. Jason Kraft, hip and knee specialist, Mississippi Sports Medicine and Orthopedic Center. He joins us on the Coors Light guest line. You're listening Out of Bounds, ESPN 105.9 The Zone. So he just walked us through Tua Tagovailoa's injury. It happened in Starkville. It was about 5 months ago, and he's had a successful surgery and rehab. He'll be drafted next week in the first round. It's just a matter of when. So Jason, you were not surprised within the last couple of weeks that when the videos were released of him moving around and working out and throwing the football 5 months after a injury/surgery like this?
Right. Yeah. I mean, these guys are unbelievable athletes. They are, I kind of joke with people about it. They are not the same as you and I. They recover quickly. It's really amazing what they're able to do. And so once, I did not specifically examine him at the combine. But by all reports, everything looked great. He was moving great, and I'm not surprised to see that he's where he is now, 5 months out from that injury.
So people talk about this in the world of sports about guys are injury prone. Do you buy it? And so he's had some other minor hiccups. That's part of it when you play sports. I don't buy into it, but I don't know anything about it. So when you hear that, not just about Tua, but just about any athlete, what direction do you go? What's your initial reaction when you hear something like, someone gets injured 2 or 3 times over the course of 3 years? Are they injury prone, or do you buy into that, Jason?
I think, certainly you'd like to look at his case and anecdotally say, oh, he's injury prone, but there's really nothing really scientific to back that up. There are some injuries that we know that once you have one, you're at higher risk for further injuries. There's been studies looking at the collagen makeup of people that have multiple injuries, and maybe there is some suggestion, but there's certainly nothing been proven. I can promise you if there was anything proven and you could evaluate somebody's risk for multiple injuries, then the NFL would be testing for it.
Yeah.
I think it's all anecdotal. I think you kind of have to take, each injury by itself. I mean, you've seen, you see these guys come through the combine, and some of them, playing in the most difficult positions on a team, have never been injured. And then some have had, 6 or 7 different surgeries. And then you kind of keep up with their name and watch their career. And the guy that's been hurt 6 or 7 times, really never has any significant problems throughout the NFL. And the other guy gets hurt a couple times. I don't think there's any way. There's nothing definitive. I will say that one of the things I think the NFL does is probably probably the major thing of the combine is evaluating risk. You kind of mentioned it, and so I think talent is always going to trump a lot of that. So if you have 2 equal players and one is and you rate their skill levels equally, one has had 3 surgeries, one has had no surgeries. One has some issues that may become, problems over the next couple of years. They're going to probably take the guy that's never had any problems. But if you have somebody like Tua, who's probably just a really elite talent as a quarterback, then you need such a good quarterback that you probably overlook some of those issues to have the chance of having that elite quarterback on your team.
Sure, that makes sense. Dr. Jason Kraft, Mississippi Sports Medicine and Orthopedic Center on ESPN 105.9 The Zone. All right, let's switch gears here and talk about the NFL Combine. What is it like? Take us through that. What is it like to work the NFL Combine as someone who is in sports medicine and an orthopedic surgeon?
Well, my background, how I got into it, I trained with the guys in Houston that take care of the Texans, and just really had a great relationship with them the year I was out there, and they've just invited me back to continue to help. It's so for them, it is absolutely just work. For me, it's a great learning experience for me to be able to sit down in a room with some of the best sports medicine minds in the country and listen to them talk about injuries and surgeries that have been done. And, hey, this is going to be the next surgery if this guy has a problem. That's just, for me, it's an unbelievable learning experience and something that I bring back to take care of my patients. It's neat. There's nothing, you can't really say much different than that. I mean, it's pretty impressive to see these guys. They're so massive. It would be petrifying to have these guys chasing you around.
No doubt.
It's amazing. It's amazing they don't get hurt every play. They're all so big. It's really just neat to see the business of it, just how, these guys are, you see these contracts. So these guys are really just huge investments for these teams. And the combine is about evaluating that investment. You wouldn't buy a fancy sports car without test driving it or anything without test driving it. So that's really what these guys are trying to do. They're really trying to see what they're going to invest their money in. And it's really just neat to see that process.
Dr. Jason Kraft, Mississippi Sports Medicine and Orthopedic Center on the Out of Bounds Show. When you're there, Jason, can you feel the tension and the pressure as the different players go through all the different exercises and skills that the NFL asks them that requires them to do?
I get asked that a decent amount. So just kind of the way the week works. By the time you see them on TV, we are pretty much finished. So they have to do all their, just like you would have a physical to play on your high school football team, that's basically what they're doing at the combine. So a couple days before it really starts showing up on TV, we've already been working. The guys come through, they do a medical exam, and then it's really, the combines between teams is a little more collaborative than you would think. And so they go through several different rooms and they get evaluated. And in general, the players, they're pretty bored at the part that we do because it's just the same exam over and over. But I think it's a tough day for them because it's probably the day that they have the least amount of control over. They can work out as much as they want. They can work on their 40s and their vertical leap and all their position-specific drills, but they really don't have a lot of control over their, to some extent, the outcome they've had of injury. So they may have had an ACL surgery when they were freshmen in college, and they've done great through college. But, by the time they come through the combine, maybe some cartilage is breaking down. Maybe they're having some trouble. And to no fault of their own, it's just something they can't control. It's just sort of the nature of what they do and the injuries that they've had. And so I think it's frustrating for them because they don't have any control over it. And then to hear people talking about, well, he's got this problem in his knee, and he's like, man, my knee's fine. It hadn't bothered me in 4 years. So I think it's a boring day. I think it's a frustrating day for them. But it's just amazing how even the ones that are pretty beat up that come through our rooms that have had a bunch of injuries and surgeries. And I've seen people that, for me in my practice, if they came in, I would say, well, the next surgery you need is probably, you're probably getting close to a knee replacement. And then you go watch these guys work out and they're running a 4.6 40 and jumping 40 inches and play, 6 or 7 years in the NFL.
That's remarkable.
They're just unbelievable people.
Where do you think all right, Dr. Jason Kraft on the Out of Bounds Show, ESPN 105.9 The Zone, hip and knee specialist with Mississippi Sports Medicine and Orthopedic Center. As the male and female athlete continues to get bigger, faster, stronger, Jason, are we close to a ceiling? Or is it just, what do you see the next frontier as far as training? Are athletes just going to continue to get bigger, faster, stronger 10 years, 20 years down the road?
That certainly seems to be the trend. I don't think if you asked people 20 years ago that they would think that, the guys are going to be as big as they are now, that you're going to have, 6'4", 230 wide receivers. And, that was a tackle,
right.
30 years ago. So, but I think, that's a good question. My other thought is that maybe we are starting, maybe guys are going to get bigger, but maybe we don't necessarily need them to be bigger because we're starting, with all the concussion stuff, you can get your quad and your core and your upper body strength better, but we're really not we're not able to protect our brain any better. And, you're starting to see some change in the rules to try to protect that. So maybe we need to hit a ceiling. I don't know.
Good point.
Good question. Yeah.
We just had a listener text us, and they had a question on Jeffrey Simmons. You mentioned ACL earlier in the interview.
Yeah.
Dr. Jason Kraft on the Out of Bounds Show. And so the texter asks, as someone who's a hip and knee specialist, and knowing that Jeffrey was able to come back in, I think, about 9 months, Blake, somewhere in there, from his ACL and be productive as an NFL player as a rookie. Talk a little bit about that, Jason.
No, I think that's the right time frame. Even when he came in, his snaps were limited. We talk about 6 months back from an ACL, but that I think for those guys at that level, it's 9 months, 10 months, 11 months, if not a year. And I think what you're seeing, part of that is just a tribute to the unbelievable athlete and just kind of physical specimen he is, that he's able to come back to that level that fast from a pretty significant injury. And so, but I think that time frame's right. He had, he had I know a surgeon. He had a great surgery. He did a really good job rehabbing. The team that took him was very patient with him, and but when he was ready and they felt good about it, they were ready to let him go. They didn't just have this blanket statement that you need to miss your whole rookie year. When they felt like he could go, they put him back in.
We have
that's just another point, just crazy about ACL injuries. You got to think about all the double teams and triple teams that guy took all through college, and then for him to tear his ACL stumbling, doing a cone drill, working out for the combine.
I know, non-contact.
Yeah, it's a crazy thing. So when you talk about risk of injury, that's, there's specific, and people being injury prone, there's specific injuries that they have more data about. So an ACL injury. So if you've had an ACL injury prior to going into the NFL, then there in the first 2 years, 25% of players will have another ACL injury.
Oh, wow.
Versus only 10% if you've never had an ACL injury. So they have, and they still take kids that have torn ACLs all the time. So they understand the risk. They manage the risk when they take these guys. They have some information about specific injuries, but I think just a global statement, somebody's injury prone. And and back to Tua, I think a couple of those ankle injuries, I think some of those surgeries were probably a little bit related to timing, where he was in his season, trying to get back. College is different than pro. You've only got them for a finite amount of time, so they try to maximize what they're able to do. Where, and I don't know for sure, my thought would be that maybe in the NFL, if he has those high ankle injuries, that probably there's a chance, I think, maybe he doesn't have surgery for them, just because he's got a longer career, and him missing a few more months here and there is probably not as big a deal as missing half the season or missing a national championship when he's at Alabama. So maybe those injuries are, and high ankle injuries happen all the time. So I think some of those injuries are maybe not as severe as others, or somebody that's had 4 ACL injuries coming through college, then, maybe that's a bigger risk factor for somebody coming through than the injuries that he's had.
That makes sense. You're listening to the Out of Bounds Show on ESPN 105.9 The Zone. Dr. Jason Kraft, Mississippi Sports Medicine and Orthopedic Center, hip and knee specialist. Jason joins us on the Coors Light guest line. We're talking sports injuries, Tua Tagovailoa, and as we head into the NFL draft. So we have another question from a listener. You mentioned ACL. Can you explain the difference? Because I think we throw this out all the time, but most people don't know exactly what the difference is between an ACL and an MCL tear, and as far as the comeback and rehab, Jason.
Yeah, absolutely. That's a grereat question. So there's 4 major ligaments inside the knee. It's a medial collateral ligament. So if you touch the inside of your knee, kind of right along the bony part of the inside of the knee, you're touching your medial collateral ligament. And its main job, it has a lot of little micro jobs. Its main job is to keep your foot from swinging laterally and your knee staying in place. So if your knee was to go it tries to keep you from going knock-kneed. The ACL is a different ligament. It's in the middle of the knee. And its main job is kind of controlling some twisting and pivoting activity. So you can tear your ACL and do stuff in a straight line. You can run in a straight line. You can walk. It's that cutting, twisting, pivoting that gives you trouble. The medial collateral ligament is the most common ligament that's injured that we see, but it has the highest capacity to heal on its own. So just where it's most likely injured, partial tears can heal, and you can even tolerate just a little bit of laxity in it if it doesn't just completely heal on its own. And some of those that are partial, there's different grades. There's some that, guys tweak and they go in at halftime, they put a brace on and they can play in the second half. There's some where they're back in a couple weeks. There's some that are higher grade tears where you've completely torn the ligament that may take them 6 weeks to get back. But for the most part, they heal on their own and don't require surgery. The ACL just does not have the capacity to heal. Once it's torn, it's really like I tell patients, it's not one thing that breaks in two. It's a rope, and if you think about it's 1,000 little things. And when you think about that rope breaking, it's these 2 big frayed ends, and there's no way that that's going to heal and really grow back together. There's research going on to try to make that happen, but there's nothing that's really been proven to be effective. So once it's torn, it's torn. And so then you take if you take a middle-aged guy, that maybe, he just kind of slipped and fell, then some of them can tolerate not having an ACL. But you take a higher level athlete, high school, college, pro athlete, all the twisting and turning that they do, they just can't tolerate it. They will do, and every time they pivot, it's not just that it's torn. Every time they pivot where the ACL would function, the knee actually twists out of place and then pops back into place. And
Yikes.
that does damage. That does damage to the cartilage. It does damage to the meniscus. That leads to early arthritis and major problems. And that's why, for the most part, kids that tear them, they're done. You have to fix them, and that's kind of the way it is. There are very few instances where we try to brace a kid to maybe give them the option to try to finish out a senior season or something like that, but that's really kind of the only time we even consider it. Most of the time you just need to fix it. The risk of doing more damage is just too high. So MCLs on the inside of the knee, most of the time it will heal on its own. It may take a week or two to get back. The ACL is in the middle of the knee. You can't touch your ACL. And when you tear it, it won't heal and require surgery to fix it.
All right. Dr. Jason Kraft, Mississippi Sports Medicine and Orthopedic Center on the Out of Bounds Show and ESPN 105.9 The Zone. All right. So that was great. Jason, we appreciate it. Real quick, I've got about a minute.
Sure.
If you would, Jason, just 60 seconds. Tell us about the new surgery center and clinic and how excited Mississippi Sports Medicine and Orthopedic Center, how excited y'all are to offer this to Central Mississippi and the state of Mississippi.
Yeah, it's a great place. We've been it's really even exceeded our expectations to have, our surgery center. We've expanded it to have our clinic in one spot. There's certainly a trend in orthopedic surgery, especially doing stuff on an outpatient setting. And so for us to be able to offer that to the people of Mississippi, just kind of all in one spot. We're doing, from the stuff I do with, knee surgeries and hip surgeries to spine surgeries to hip replacements and knee replacements, and really probably the vast majority of the things we do now we're able to do in an outpatient setting out here in Flowood. We've got clinics set up right next to it. We've got a turf field out the back for kids that that are recovering from like an ACL injury, and they go through a return to sport program of cutting and twisting and pivoting, just like what Jeffrey Simmons would have gone through to help these kids get back to play their high school sports. So it's just a great place. We're glad to have it out here in Flowood.
Dr. Jason Kraft on the Out of Bounds Show. Jason, we appreciate it. Thank you so much.
Absolutely. Thanks, Bo. Anytime.
Dr. Jason Kraft with Mississippi Sports Medicine and Orthopedic Center. Blake, that was good.
Yeah, that was awesome.
And I'd never thought about just kind of rolling out the ACL, MCL deal because we talk about it all the time. That was really a good way to wrap up the interview. Tua Tagovailoa he will be drafted in the first round next Thursday. Who will take him? We'll discuss that on the other side. And we've got a couple more interviews that we'll tell you about at 8 a.m. We're live in the Bank Plus studio. The show is powered by the award-winning Dancing Rabbit Golf Club and also brought to you by Mississippi Sports Medicine and Orthopedic Center.